Last year, the Jules Browde public lecture series centered on an academic thesis hosted by retired Justice of the Supreme Court, Malcolm Wallace. This year, Group 1's Practice Development Committee embarked upon a more ambitious topic, the much debated, and dare I say, controversial topic of national health insurance.
There are places where we see excellent health services. Even in the hospitals that get bad press, we see patients who are looked after well. We have one hospital in the public sector that does more deliveries than half of the entire private sector in one hospital.
I'm very concerned about poor access to care for many, many poor people in our country.
And what we also do know is that obviously in a country like South Africa, we already have multiple examples of institutions that have been created to become these legitimate conduits.
The right of access to health care is not so much about the availability of hospitals, medical practitioners. It's about the ability to access those services. For a person who lives in rural areas where the simple are no hospitals or not out, how does that person have access to health services?
Those who have can always argue that tomorrow is the right time for change. For the have-nots, today is not soon enough. I'm really hoping that where we are going is towards a health system that works better for everyone.
You mentioned a figure of 1 trillion implementation. It's not the first time you mentioned it. I'm just curious as to how you arrived at that figure.
If you want the NHI to work more like the NHS, what do you say about failing NHS capacity and the attempt to now externalize that through the use of the private sector?
We have universal health care. What then is this meant to add? And if you strip it of all the rhetoric, it's adding that it's actually just an attack on the private sector.